The provision of quality health care has been one of Kenya Kwanza's key priority areas in the journey towards the attainment of universal health coverage. Since assuming power, major reforms have been undertaken, including at the Kenya Medical Supplies Authority, in order to improve service delivery. Recently, the Cabinet also passed 4 health bills, among them the Primary Health Care Bill and the Social Health Insurance Bill 2023. Our reporter Nancy Okware takes a look at some of the key reforms in the health sector 1 year since Kenya Kwanza administration came into power.
Susan Nakhumicha Wafula, being appointed a Cabinet Secretary of Kenya.
On the 27th of October 2022, Susan Wafula Nakhumicha was sworn in as the Cabinet Secretary for Health, taking over from Mutahi Kagwe. The Ministry of Health was at the time plagued by a number of challenges, including lack of basic medication in public facilities and corruption allegations at the Kenya Medical Supplies Authority, for instance, tendering of mosquito nets. In order to restore sanity, major changes were made at KEMSA, with the previous board disbanded and a new one chaired by Irongo Nyakera inaugurated on the 18th of May 2023.
We have individual culprits who taint the image of this institution. I will not stop at anything. Even if it means sending home a whole department, I am ready to deal with it.
Despite the changes, some public hospitals are still struggling. The Cabinet, while in Kakamega on the 29th of August 2023, considered and approved crucial bills that promote healthcare for transmission to Parliament. The bills are the Primary Healthcare Bill of 2023, the Digital Health Bill of 2023, the Facility Improvement Financing Bill of 2023, and the Social Health Insurance Bill of 2023. The bills are set to usher in a paradigm in the legal and institutional framework for healthcare in Kenya by repealing the current National Health Insurance Fund. In its place, the Primary Healthcare Fund, Social Health Insurance Fund, and Emergency, Chronic and Critical Illness Fund will be established if passed by Parliament.
For me, I feel that it is a diversifying and being all-inclusive. One thing that I'm not still appreciating in that bill is that the Kenyans have been complaining of the money we lose through corruption. There is no specific measures that have been proposed in that bill to ensure that we are not going to lose our money again through corrupt process.
On the other hand, the Digital Health Bill addresses the existing legal and regulatory gaps in the framework for the e-health ecosystem and its data life cycle, enabling the development of standards for the provision of mHealth, telemedicine and e-learning in healthcare.
Telemedicine is all the world is going, and we must be able to be there because the young people are interacting via virtually, and also the healthcare workers can be able to give them services or even connect them to the kind of services they need at that time, including referral system.
This new architecture is expected to provide a framework for improved health outcomes and financial protection of families. As part of efforts to shift from a curative to a preventive mode of caring for patients, the government is set to unveil 100,000 community health promoters on the 20th of October 2023 during the Mashujaa Day celebrations. These will help in decongesting hospitals as minor ailments can be identified and treated at the community level.
When you have a flu, you will be told that this is the level that you need to start. And if the community health promoter can handle, you don't need to go to hospital.
The Ministry of Health recently conducted a health facility census. The exercise was aimed at identifying the number of hospitals and the number of staff and equipment available, with a view to inform policy formulation to improve services.
The President, through his manifesto, had promised to employ healthcare workers more than 100,000. But he had focused the first year 20,000. And our worry is that we have not seen any fund allocated in terms of the budgetary allocation, those that can employ the healthcare workers.
Kaunti yetu kwa upande afya ni mzuri sana. Sasa tukipata hapo hospitali tunahudumia mzuri. Daktari wako sawa. Tunapata dawa mzuri.
Serikali wapeleke huduma huko mashinani, sub counties, ndio wale wanaishi 300 miles and above waweze wapate huduma palipo huko walipo.
Watuletee kwa huduma, wananchi hawawezi fika pahali hospitali, labda mwingine anaweza toka mahali inaitwa Korome, mahali zingine huko Bokolo, na mtaji wa dawa ya kutumia hiyo kadi ya NHIF hawezani naye.
Despite the numerous reforms that have been made in the health sector, healthcare unions are still of the opinion that more still needs to be done to address the human resource aspect. Nancy Okware, the Government Scorecard.